Hello, my name is Eric Pappas. I'm Emeritus Professor in the School of Optometry and Vision Science at the University of New South Wales. Peripheral neuropathy and dry eye disease are both common manifestations of type 2 diabetes. While it seems reasonable to suspect that there's a link between these two conditions, how this may occur is not fully understood. Likewise, we often use artificial tears to treat secondary dry eye, but the value of using this approach for those with diabetes remains largely unstudied. To look into these two questions, my colleagues and I conducted a two-phase investigator-initiated trial, and in phase 1, we evaluated participants who had type 2 diabetes to identify those who also had dry eye disease. And we looked to see if this was associated with the presence of peripheral neuropathy. Then in phase 2, we entered the dry eye group into a randomized crossover study to examine the outcomes of using Systane Hydration, artificial tears on a daily basis, compared to a saline control. What we found in phase 1 was that about half the 63 diabetic participants also had dry eye. Furthermore, the odds of having dry eye were significantly higher when the neuropathy was more severe. This greater risk was reflected in significantly higher DEQ5 symptom scores for those with moderate or severe neuropathy compared to those with either no or only mild neuropathy. The more severe neuropathy subgroup also had significantly lower mean tear production as measured by the phenol red thread test. That tear production decreased as the severity of neuropathy increased was also evident from a correlation analysis, as was an accompanying reduction in the length of nerve fibers at both the center and the periphery of the cornea. Among the 23 dry-eyed participants who completed phase 2, there was a significantly greater improvement in symptoms as measured by the Ocular Surface Disease Index after 1 month of treatment with Systane Hydration compared to 1 month of using saline drops. There were no other differences in signs or symptoms between the treatments. And we also looked for evidence of significant anatomical or inflammatory changes, but again, none were observed for either treatment during the course of the study. So in summary, our results suggest that individuals with peripheral neuropathy that's related to type 2 diabetes, these people have a higher risk of developing dry eye disease, and this may be related to reduced tear production in these people. Data from the treatment phase showed that Systane Hydration PF, which combines 2 lubricants with HP guar and hyaluronic acid in a preservative-free solution, may help alleviate dry eye symptoms that are secondary to diabetes.